1,500 medications, and my patient is complaining of severe pain. Okay. So 1,500 medications is Levaquin and digoxin, and severe pain is morphine 3 milligrams. And then I'm also administering the influenza vaccine because it's due now. So then I need my math for my morphine, which is 3 milligrams per over 2 milligrams per 1 ml, which is 1.5 mLs. With morphine, I'll confirm her last dose, her pain, and where. I'll need a full set of vitals, and I have dig, so I need the dig level. And I'll need her apical. Let's see. Levaquin, flu vaccine, morphine, and digoxin. Make sure. Yep. Okay. So then, looking at the dig level is at diagnostics, and it is 0.9, which is within normal limits. And that's the only lab I need to look at, so I can start pulling. Morphine, flu vaccine. I don't need any other vitals. Digoxin, secondary tubing, and Levaquin. I need a cup for my digoxin. I need my labels. Alcohol. 3 ml syringe, since I'm giving 1.5 mLs of morphine. A 1 ml syringe for half an ml of the flu vaccine. 2 flushes for morphine. 2 blunt tips to draw up, and an intramuscular needle for my flu vaccine. I'll fill out my labels. Labels are done. Check for everything. I have my vaccine information sheet. I have all my materials, and I do have everything. Okay, so then I am ready for my proctor.
Hi there.
Hello.
Thank you. All right, so I'm gonna start the timer. You have 30 minutes. If you go over 30 minutes, that's fine. Don't panic, just keep going, okay? So 30 minutes.
Okay.
You ready?
Yep. All right, I have Florence Nightingale. Her date of birth is 10/17/19XX. She has allergies to penicillin. I will be administering the 1500 medications, and she's complaining of severe pain.
Okay.
So first, I will be starting with morphine, 3 milligrams IV push every 6 hours PRN for her severe pain. Can you confirm the last dose?
It's been more than 6 hours ago since she last received it.
All right, so I'm safe to give that, and then I do have my map up here.
Perfect.
And then I will be administering digoxin because it's the PO med, and I'll be giving 0.125 milligrams by mouth once daily, due at 1500.
Okay.
Third, I'll be giving the flu vaccine. I will just confirm that she hasn't gotten it this season,
Excellent.
and I'll be giving 0.5 mLs intramuscularly, and it's due now.
What was that dose again?
0.5 mLs intramuscularly.
Thank you.
And then fourth, I'll be giving her Levaquin. This is her antibiotic for pneumonia, and it's 250 milligrams per 50 mLs IV piggyback every 8 hours, due at 1500.
Okay.
All right, so then I'm ready to start drawing up my meds. Wash my hands. Pull some gloves out. Start with my morphine, scrubbing the hub for 30 seconds. And I'm giving 1.5 mLs, so I'm pulling that much of air. Pulling more than needed so that I can push out the rest of the air. And here is my label.
Okay, thank you.
And can I get my 2RN check?
Yes. Okay, looks good.
Thank you. Digoxin does not need prepared. I will pull up my flu vaccine. Scrubbing for 30 seconds. Giving 0.5 mLs, so 0.5 of air. Again, drawing more medication than needed to push out air. digoxin. Switching the needle now so that I'm not forgetting to do that in the room. This will go in the sharps. And make sure I have everything. I do. Good to take my gloves off. Wash my hands. I'm gonna get another set of gloves so I'm ready for when I'm in the room.
Okay.
And I'm ready to see Miss Nightingale.
Okay, let's go in her room.
Knock, knock, knock. Hello, Miss Nightingale.
Oh, hi there.
How are you today?
Oh, I'm having some pain.
Okay, well, I'm here and I can give you your medications and I can get some pain medication for you to help with that, okay?
Okay.
All right, can I have you confirm your name and your date of birth?
Florence Nightingale, 10/17/1958.
All right, and do you have any allergies?
I'm allergic to penicillin.
Okay, so I won't be giving you anything that will interfere with your penicillin allergy. Okay. All right, so I'm gonna go ahead and read through the medications that I have for you today, okay?
Okay.
It's 1,500, so I'll be giving you your scheduled medications as well as a couple others.
Okay.
So you said you have some pain. Can you rate that on a scale of 1 to 10?
Oh, it's about an 8. I'm really uncomfortable.
Oh, and where is that pain located?
It's in my hips and my knees.
Okay, so it sounds like you've got some pain from your osteoarthritis. So I can administer some morphine, 3 milligrams IV push every 6 hours for some severe pain. And it looked like your last dose was over 6 hours ago. Do you know when your last dose was?
Oh, yes, it was sometime yesterday.
Okay, perfect. So I'm safe to give that, and I'll get a full set of vitals before I do that. But we're gonna continue going through your meds. So second, I'll be giving you your digoxin. It's 0.125 milligrams by mouth once daily, due at 1,500.
Okay.
This is for your AFib and congestive heart failure. And then I have here that you need the flu vaccine. Have you gotten it this season?
I have not, but I get it every season.
Okay, so you want to get your flu vaccine today?
Yes.
Okay, so then I'll be giving you your flu vaccine, which is 0.5 mLs intramuscularly, 1 dose due now. And then I will be giving you your Levaquin. This is an antibiotic for your pneumonia, and it's 250 milligrams per 50 mLs IV piggyback every 8 hours, due at 1,500.
Okay.
All right. So then can I get a full set of vitals?
Yes. Her blood pressure is 120/80. Her heart rate is 80. Respirations are at 20. O2 sat is at 99%. And temperature is 37 degrees Celsius.
All right, so your vitals look good, which is very important because morphine can make those vitals drop a little bit. So if they were too low, I wouldn't be able to administer your morphine.
Oh, okay.
But it looks like we're safe, and I'll just monitor your vitals afterwards, okay?
Okay.
And so I'm gonna go ahead and wash my hands and put on some gloves, and then we'll give you that morphine so hopefully it can get that pain level down, okay?
Okay.
I'm gonna go ahead and raise your bed so it's a little higher so that I don't have to bend down to work, okay?
Okay.
Are you still comfortable?
Yes.
Okay. here. Alright, so we're going to start with that morphine for your pain. It's 3 milligrams, and I'm giving you 1.5 mLs.
Okay.
I'm going to scan your wristband. And then scan the medication. I confirm that dose, 3 milligrams, 1.5 mLs. It's going IV push. It's PRN. Your last dose was over 6 hours ago. I did my 2RN check, confirmed your pain, confirmed your vitals. I've done all my checks. I'm gonna go ahead and clean your IV port while also crimping the line. Cleaning for 30 seconds. Starting with a flush to confirm patency. And I'm flushing for 1 to 2 minutes, watching the IV site. Do you have any pain right here at your IV site?
No, it feels okay.
All right. Next, I have the medication, and I'm gonna push. I would clean that. I'm gonna push this medication for 3 to 5 minutes so that it doesn't go into your system too fast. And then a final flush, because there's still some medication in the IV tubing. Just make sure it all gets into your system. This would also be pushed for 3 to 5 minutes just because of that medication in the tubing. Make sure it's not in your system too fast.
Okay.
All right. How are you feeling after that?
I feel okay, just a little metallic-y taste in my mouth.
Oh yes. That can be expected with getting an IV push medication.
Okay.
And then this medication can also make you a little dizzy, so just let us know when you need to get up to go to the bathroom or anything, and then we'll help you make sure you don't fall.
Okay.
All right, next I have your digoxin. Now, I checked your dig level. I needed to make sure that it wasn't too high so I wouldn't give you too much medication in your system. Your dig level is 0.9, which is within normal limits, so this is safe to be given.
Okay.
I also need to check your apical pulse. I'll be listening to this and counting. I listen for a full minute and count the pulse.
Apical pulse is 78.
78. So that is above 60, which means that I am safe to administer her digoxin. And I'm gonna go ahead and raise the head of this bed for you, okay? Because this is going in your mouth and you gotta swallow. Can't really do that laying down.
Okay.
All right, I need to check your swallowing. So can you take a sip of water?
Gulp.
All right, and did you have any pain or discomfort with that?
No.
All right, so you didn't have any dysphagia or any issues, so you're safe to swallow this medication. I'm gonna go ahead and scan it in. And I confirmed the dose with you, that it's 0.125 milligrams. It's going by mouth, due at 1500. I did my apical, I checked my dig level, and I checked your gag reflex. So we're good to administer this medication. Here's your medication.
Gulp.
Here's water.
Gulp.
And that is administered. All right. How you feeling, Miss Nightingale?
I feel okay.
All right. Next, I have that flu vaccine for you, okay?
Oh, okay.
And I have a information sheet for you. This just tells you all about the vaccine, okay?
Oh, thank you.
And you confirm that you didn't get this season, so it's okay to give this to you. And you did give me your consent, and just making sure, do you still want this vaccine?
Yes, please.
All right, and do you have an egg allergy at all?
No.
All right, so I am able to give this medication to you. I'm gonna go ahead and scan this in. And I confirm the dose is 0.5 mLs. It's going intramuscularly, and it is due now because you haven't had it this season. I gave you your vaccine information sheet. I checked your egg allergy, and you haven't gotten it this season. All right, this is going in your deltoid muscle. It's right here in your shoulder, 3 fingers down from the acromion process.
Okay.
I'm gonna go ahead and clean the site in a circular motion for about 30 seconds. Let that dry a little bit. All right. And then I'm going to spread so that I'm in the muscle, going 90 degree, 1, 2, 3. All right, how's that feeling?
That feels okay.
All right.
Just a tiny pinch.
Yep. It's gonna get a little bit sore and a little bit achy. Just try to move your arm, prevent some stiffness, okay?
Okay.
Let us know if it gets too painful or if you can't move your arm at all.
I will.
All right. Lastly, I have your Levaquin. This is gonna be for your diagnosis of pneumonia. It's an antibiotic. It's gonna go in your IV. I'm just gonna be messing with this pump here, so if you want, I can lay you back down a little bit to get you a little more comfortable.
That would be great. Thank you.
Okay. You just let me know when to stop.
That's good.
Okay, and then I'm also gonna put your bed to the lowest position. Very good. Okay, so I have your levofloxacin. I confirmed with you that this dose is 250 milligrams per 50 mLs, IV piggyback, due at 1500. I checked your IV patency when I did the morphine, so I know that this is okay to go in your system and your tubing isn't messed up.
Okay.
And this is not in the same family as penicillin, so it won't cause a reaction with your allergy at all.
Okay, good.
Closing this. And then okay. How you feeling, Miss Nightingale? Is your pain any better?
Yes, it's about a 6 now. I can tell the morphine's working.
That's good. I'm glad to hear that. Clean the port above the pump for about 30 seconds. While that dries, I'm gonna hook this guy up. And bring this down for back priming. Making sure the medication is upright. it about halfway full. And then close it. Go ahead and hang it up. All right, Miss Nightingale. I'm gonna open this for you. Make sure it's running through the pump. And your bed's in the lowest position. Do you need anything else before I head out?
No, I'm okay, thank you.
Okay, I'm gonna take my gloves off. I'm gonna wash my hands. All right, I'm gonna make sure that I did all my education, and I'm just gonna let you know that your antibiotic can cause some GI upset, so just let us know if you have any of that, and we can get you taken care of with maybe some crackers or some nausea medication. And I have your call button right here. Just remember to call us if you need to get up for any reason, because some of these medications can make you dizzy, okay? I don't want you falling at all.
Sounds good.
Go through, I did everything, and I'm going to go ahead and end my medication checkoff.